Seeking help isn't weakness, it's a sign of strength. There's a phrase millions of people still believe: I don't need therapy, I can handle this myself. But there are 5 signs that show you're not just a little stressed. You need professional help right now. This isn't about whether you're weak or broken. This is about recognizing when your brain and emotions need support to function better. Today, we'll look at 5 clear signs that it's time to seek therapy. Explain different types of therapy and, most importantly, how to find help even when you think you can't afford it. Let's begin. Sign number 5, nonstop negative thinking. You wake up in the morning. Your first thought isn't what will today bring. It's why do I have to wake up, or another terrible day begins. Every thought is colored black. You look in the mirror and only see flaws. You think about the future and only see failure. You review the past and only see regret. This isn't looking at life negatively. This is a sign your brain is in a state of chemical imbalance. How it works. When depression or anxiety persists, your brain starts creating negative neural pathways. Like a path in the forest that becomes clearer the more you walk it, the more your brain thinks negatively, the easier it becomes to continue thinking negatively. Neurotransmitters like serotonin and dopamine become imbalanced. These are the chemicals that help you feel happy, motivated. When they're low, your brain automatically leans toward pessimism. Your prefrontal cortex, the part that helps you regulate thoughts and emotions, functions poorly. Meanwhile, your amygdala, the fear processing center, is overactive. Research from the National Institute of Mental Health shows people with clinical depression have up to 80% of their daily thoughts being negative. And these thoughts don't just make you sad. They actually change brain structure, making depression deepen over time. What this looks like in real life: you might wake up exhausted even after 8 hours of sleep because your brain has been working all night with anxious thoughts. Unable to enjoy things that used to make you happy because your brain can't produce enough dopamine. Automatically assume everyone dislikes you, everything will go wrong, you'll fail. Lose ability to concentrate because your brain is too busy with bad thoughts. Feel guilty about feeling bad, creating a loop with no way out. Validation: this isn't you overthinking. This isn't you needing to be more positive. Your brain is in a chemically imbalanced state that needs adjustment. Therapy, especially cognitive behavioral therapy or CBT, has been proven to change these neural pathways. You don't have to fight your own brain alone. Sign number 4, every relationship has problems. You argue with your partner, again, about the same thing. You distance yourself from friends because they don't understand you. Your family says they're worried about you, but you feel they are attacking you. And the worst part, you think, the problem is them, not me. But when every relationship has the same problem, it might be time to look in the mirror. Why this happens: unresolved issues in your psychology don't stay in your head. They spill out into every relationship. If you have trust issues from the past, you might unconsciously push people away. If you have abandonment fears, you might become clingy or controlling. If you don't know how to handle emotions, you might explode over small things. Psychologists call these attachment patterns or schemas. These are behavioral templates you learned early, and you repeat them without realizing. According to research from the American Psychological Association, 75% of people seeking therapy have at least one relationship issue as a main reason. And interestingly, when they address their personal psychological issues, their relationships often automatically improve without needing couples therapy. What you might experience: people with unresolved relationship issues often argue about small things because they're actually angry about big things left unsaid. Feel no one really understands them because they haven't understood themselves. Sabotage good relationships out of fear of being hurt first. Withdraw or explode with no middle ground. Repeat the same drama with different people. There's a saying in psychology: if you meet one difficult person in a day, you met a difficult person. If everyone you meet is difficult, you might be the difficult one. Validation: this doesn't mean you're a bad person. This doesn't mean everything is your fault. But if you notice this pattern, therapy can help you understand why you act this way and learn healthier ways to interact. Good relationships can be built, but first you need to understand your behavioral patterns. Sign number 3, small things make you collapse. A friend cancels plans, you cry. Your boss asks you to redo a report. You feel like the world is ending. You spill milk. Your whole day is ruined. People around you say, "Why are you so sensitive?" But to you, everything really does feel like the apocalypse. This isn't being overly sensitive. This is a sign your stress coping system is exhausted. What's happening in your brain? Think of your ability to cope with stress like a phone battery. Every day, normal stress drains the battery a little. Sleep, good food, social connections recharge it. But when you experience chronic stress, anxiety, or depression, your battery is only at 10% before the day even starts. Any small thing can drain it completely. Cortisol, the stress hormone, is constantly elevated. Your sympathetic nervous system, the fight or flight system, is always on. You never truly relax. Your prefrontal cortex, which helps you regulate emotions and respond appropriately, is overloaded. It's like a manager handling too many crises at once. Eventually, it gives up. Research shows people with these symptoms often have cortisol levels 3 times higher than normal people. Their brains are in continuous survival mode. they're not overreacting. They're reacting as if in a life or death situation because their brain thinks that's reality. In real life, this means you might cry over things you know are not worth it but can't control, avoid normal situations because you're afraid you can't handle them, feel exhausted all the time even when you haven't done much, be easily irritated, explode at people you love, have physical symptoms like headaches, stomach pain, chronic muscle tension. One important thing to understand, this isn't you being weak. This is your biological system being overloaded. Like a computer running too many programs, you need to reboot and learn to manage the load. Validation, therapy, especially techniques like mindfulness-based stress reduction and somatic therapy, can teach your brain how to turn off emergency mode. You can learn how to recharge your battery and increase battery capacity. You don't have to live in a depleted state forever. Sign number 2, you need alcohol, drugs, or stimulants to feel okay. 1 drink after work to relax, then 2, then every night, or you can't start the day without coffee and painkillers, or you use cannabis every night to sleep. You tell yourself, I'm not addicted, I just need it to cope. But that's exactly the problem. You can't cope without it. Why this is a dangerous sign when you use substances to cope with emotions. Your brain learns a dangerous lesson. I can't handle this feeling myself, I need outside help. This creates a loop. You feel anxious, you drink. Anxiety disappears for a few hours. Your brain records alcohol solves anxiety. Next time anxiety hits, your brain doesn't look for healthy coping, it just wants alcohol. Over time, you need more to get the same effect. Your brain adapts to the substance, and when you don't have it, emotions return stronger. Worse, alcohol and many substances actually make depression and anxiety worse long-term. They give you short-term relief, but deepen the problem. According to the National Institute on Alcohol Abuse, nearly 50% of people with anxiety or depression disorders also have problems with alcohol or addictive substances. They didn't start with addiction. They started with trying to feel better. This might look like you might need a drink to relax after work and can't relax without it. Use drugs or food as a way to self-medicate when sad or anxious. Realize you're using more than intended but can't stop. Feel guilty or ashamed about your use but continue anyway. Prioritize using over other activities that were once important to you. Lie or hide about how much you're using. Here's the hard truth. If you need a substance to feel normal, that's not self-care. That's a sign you need real support. Validation, this doesn't mean you're weak or lack willpower. Your brain is trying to survive in the only way it knows how, but there are better ways. Therapy combined with, in some cases, properly prescribed medication can teach your brain how to self-regulate without harmful substances. Seeking help now is much easier than later when the problem becomes more serious. Sign number 1, you feel stuck and don't know which way to go. You're unhappy with your job, but you don't look for a new one. You're not satisfied in your relationship, but you don't leave either. You know your life needs to change, but you don't do anything. Every day is the same. You wake up, go through the motions, then go to sleep. You're not really living, you're just existing. Why this matters most? Feeling stuck is a cumulative sign of everything we just talked about. Your brain is too exhausted to see options. Your relationships don't give you the support you need. Daily stress paralyzes you, and you might be using substances to numb this feeling. This isn't about you being lazy or lacking ambition. This is a psychological state called learned helplessness. Your brain has learned that, no matter how hard I try, nothing changes. So it stops trying. Research from Yale shows, people who feel stuck in life often have low activity in brain regions related to motivation and planning. Their brain has learned that action doesn't matter, so it conserves energy by doing nothing. But here's the good news. This is one of the things therapy can change fastest. When you work with a therapist, you start to see options that your exhausted brain couldn't see. You start taking small actions. Those actions succeed. Your brain relearns, I have power. I can change things. Validation. If you feel stuck, it's not because there's no way out. It's because you can't see the way out from where you're standing. A therapist can be your guide, helping you find the map again. Types of therapy and how to find them. There are many effective types of therapy. CBT helps change negative thinking. DBT teaches emotion regulation skills. EMDR helps with trauma. Psychodynamic therapy explores patterns from the past. There's no best type. There's the type that fits you best. To find a therapist, you can. Ask your family doctor for a referral. Use online platforms like Psychology Today, BetterHelp. Check if your insurance covers therapy. Look for community clinics offering low-cost services or sliding scale. The first call is the hardest, but after that, everything gets easier. If you recognize yourself in at least 2 of these 5 signs, it's time to seriously consider therapy. Seeking help isn't admitting failure. It's the first step to reclaiming your life. You deserve to feel better, and you can. In the next video, I'll guide you through exactly how to prepare for your first therapy session, what to say, and how to make the most of each session. Comment, I'm ready, if this video made you think about seeking help. Subscribe so you don't miss it. Thanks for watching. See you next time.